Five camps close to South Sudan's border with Sudan take in refugees who have fled from conflict in Sudan's Blue Nile and South Kordofan states. The refugees are totally dependent on humanitarian aid in the camps, which is still not sufficient to avert a crisis. The health situation in Batil in Maban County is catastrophic. 1 in 3 children is suffering from malnutrition, a statistic that signals a real emergency.
What we're looking at now is diseases associated with a very, very vulnerable population that has been on the run for several weeks. We see people that are malnourished. We have 1,000 children in our therapeutic feeding center. We have a lot of eye infections, a lot of respiratory infections, and all this due to the rainy season that started a couple of weeks ago.
Just see her eyes.
The camp of Yida is completely overwhelmed by the influx of refugees. They went from 17,000 in March to 55,000 in July.
When it rains, we shelter with our neighbors, and when it stops, we come and sleep on the floor without anything to sleep on. We sleep outside.
On average, 5 children have been dying each day in Yida since June, and the global mortality rate is very worrying. Due to these conditions, MSF, the main aid provider in the camps of South Sudan, has decided to increase its resources, and many MSF sections have launched an appeal for donations. Every day sees the arrival of yet more Congolese refugees at Nyakabandi transit camp. Increasing violence back home has forced them to flee their country. They settle in one of the camp's 400 tents. Supported by MSF, the Uganda Red Cross has been quick to provide them with water, food and healthcare.
MSF had been present in the area since several months, but especially since June, conducting health and nutrition evaluations. And there were a lot of other actors on site. Unfortunately, not many of them had much experience in particularly nutrition interventions. So we had a limited intervention ourselves, focused on training, setting up tents, structures.
So what will happen to these refugees? Some of them hope to go back home as soon as things improve. The others, possibly weary of the never-ending conflicts in North Kivu, want to stay in Uganda. 18,000 Congolese refugees have been transferred to another camp, where they have been given some tools and a plot of land to cultivate.
Mais ça me semble logique de travailler à le centre de santé ici.
It takes several hours by motorbike on poor roads to reach the remote communities living in Ganga Dingila Health District, where a malaria epidemic has been raging since the beginning of the year.
Bon, vous avez un peu de place?
Before we got here, there were people dying almost every day. The health centers saw many deaths. We saw 25 deaths in just 1 month in the Kana Health Center, including under 5-year-olds. It was totally unacceptable. All this just because of a lack of drugs.
Médecins Sans Frontières is the only humanitarian medical aid organization working in the area, and has repaired a landing strip to facilitate the supply of medicines. In 1 month, MSF teams have treated and provided inpatient hospital care to around 8,000 patients. However, some communities continue to report a high number of deaths, particularly among children. This has prompted MSF to call for more assistance from other humanitarian organizations. Every day, the routine is the same at the hospital in Titao district. Care providers prepare different kinds of therapeutic milk for malnourished children, who are regularly weighed to monitor their progress. This chart tracks this little boy's weight. Hamidou came to the hospital with his mother 2 weeks ago.
She says that her child got sick. 3 days later, he wasn't any better and he was suffering from respiratory distress. That's when she decided to come here immediately.
The programme run by MSF for the past 5 years shows positive results. Every year the teams observe an improvement in the children's health. And Burkina Faso is not as affected as other countries in Sahel.